A record level of drug overdoses, killing about 108,000 Americans last year. That's about a quarter of the U.S. death toll last year from COVID-19. Here to answer your questions about that is Dr. Cristina Montalvo, a psychiatrist at Tufts Medical Center. It's nice to see you, doctor.
Great to see you, Dr. Montalvo. So the number of overdoses has increased every year since the 1970s, but it has escalated sharply during the pandemic. So it may sound like an obvious question, but is there a connection in your opinion?
With what we know, there is most certainly a connection. We know that there are a few reasons behind this. One, an increase in methamphetamine now being used in conjunction with fentanyl. Also, we know that there's been a lot of increased isolation. And what this means is there's less people around with naloxone to help folks who might overdose. So leading to what we see is increase in the overdose deaths.
Doctor, you work with a lot of patients who are battling a substance use disorder. So what can you tell us about some of the challenges that they face anyway, but that they face during COVID in particular? Has it been hard to find help?
One of the biggest losses has really been a loss in the sense of community. The recovery community really relies on that, with isolation being a risk for relapse. So a lot of AA, NA, smart recovery communities had to move to Zoom, which doesn't work for everyone. So we've heard from a lot of people that early in recovery has been even more challenging.
Doctor, as you know, a lot of people say that they've experienced some level of anxiety or depression during the pandemic. So what are some of the early signs that they may be using drugs or alcohol to self-medicate?
We often see people having changes in their mood that can range from behavioral changes, people being more irritable, snapping when you wouldn't expect them to, also just not being themselves. And when that's the case, obviously we want to do something, figure out what's going on, because people will tend to then isolate or move away from those folks.
Doctor, in your opinion, is there a particular age group or community of people who may be most at risk here?
We've seen that overdose deaths has affected all racial groups, but there has most certainly been the largest increase in Black Americans, followed by Hispanic populations and Asian Americans.
Dr. Montalvo, it's great to see you. Thank you for your time.
Thank you, doctor. Stay well. And to our viewers, if you have mental health related questions that you'd like our experts to answer, just email them to ask@wcvb.com.
So check